Hi, I'm Olivia, and I am here to introduce you all to our topic. We will be discussing the importance of prenatal care during pregnancy, with a special attention to women of low socioeconomic status in the United States. Presenting alongside me will be Orlando, Catherine, and Annalise. We will begin with discussing a bit of background information and statistics regarding barriers to prenatal care. We will then discuss the importance of education, ultrasound screenings, social programming and services, and nutrition services in regards to prenatal care. Within each topic, we will also suggest solutions to these barriers through a variety of resources. To start off, 14.6 million women of reproductive age have no access to insurance that covers prenatal care. This emphasizes the cost associated with adequate care and poses itself as a potential barrier. In Michigan specifically, in 2021, 79.4% of live births were from mothers who received early on prenatal care, while 15.2% began prenatal care during the second trimester, and 5.4% began or received late or no prenatal care at all. There are many reasons as to why mothers may begin prenatal care late or not receive any at all, and that may be due to not knowing their options, financial burdens, or ineligibility for existing programs and services. According to a study done on access barriers to prenatal care in low-income women by Cynthia Cook, there are 4 barriers that seem to be the most prevalent. The first, at 44.3%, is that the expectant mother is depressed or unhappy about their pregnancy. The second, at 35.1%, is the wait time at clinics. The third, at 29.5%, is that she is too tired to seek prenatal care. Lastly, at 26.1%, the expectant mother is unable to find transportation to appointments or services.
Hi, I'm Catherine, and today I'll be talking about prenatal care with a focus on education. So, prenatal education processes aim to prepare expectant women, as well as their partners and supporters, through programs and classes that can teach more about birthing and labor processes, how to breastfeed, postpartum changes and physical changes after childbirth, how to care for a newborn baby, transitioning into parenthood, as well as how to finance for a new baby. And there's so many other classes. So these sessions can be taught either face to face or online, usually by healthcare professionals like a nurse or midwife. And they're usually taught in public health departments, hospitals, or even local community agencies. Having access to prenatal education is critical in reducing risks and complications during pregnancy and childbirth for the expectant mother and her baby. Additional benefits to prenatal educational classes are that knowledge is key. Being prepared for possible scenarios and decisions that an expectant mother might be faced with during birth can help alleviate stress and fear when it's actually happening. In addition, it can help partners understand better ways to be able to support their expectant mother, both emotionally and physically. These classes can allow for an opportunity for expectant mothers to meet other expectant mothers, and they'll be able to maybe share similar experiences or even form a bond or friendship. And lastly, it can improve communication with the patient and provider, this being that a patient may be more familiar with the terminology or how to express their certain birth preferences with the doctor. So, saying how important these prenatal education classes can be to lower complications and risk during pregnancy, it's just that some expectant women, due to their low economic status, they're not really having that equal opportunity to these prenatal classes due to certain costs and other barriers. One of the barriers is that it does cost money most of the time. The average cost of prenatal programs in the United States is around $80 to $200 per couple per class. So if you want to take multiple classes, it can really add up, in addition to already having to pay for traveling to all these doctor appointments, paying for the doctor appointments, and even actually paying for the hospital of actually having the baby. In addition, transportation is a barrier. Expectant mothers might not be able to drive, or they might not have access to a car to be able to drive to the hospitals and attend these classes. Public transportation, even like buses or taxis, they can become expensive too. So more costs. In addition to cost, there can be language barriers. So depending on accessibility, the classes that are being offered in the like local area of the expectant mother, these classes might not be taught in their native language, so they might not be able to even attend. In addition to language barriers, there's time. Expectant mothers, especially of low economic status, they are probably working to be able to support their new baby. They could be probably working later shifts or working more shifts, so they might not actually have the time to be able to attend and sit through these educational classes. And the last barrier is cultural differences. Um, just depending on the patient and provider and who's teaching these classes, they might have different views on birthing processes and how they want to proceed with their birthing processes. So it's like they might not want to have to pay for a class that they don't necessarily agree with. So, yeah.
Hi, it's Olivia again, and I'm going to talk about the importance of ultrasound screenings in prenatal care. To start off, an ultrasound is a non-invasive procedure in which the doctor and expectant mother are able to see the fetus and also the following things. First, they are able to verify if the mother is actually pregnant. They are then able to see how the growth of the fetus is coming along. They will confirm a fetal heartbeat. They will see how many babies the expectant mother is pregnant with. They can see the position of the fetus, which can help them determine the best course of action for labor. At a certain number of weeks, the ultrasound can determine the sex of the baby or babies. And lastly, an ultrasound screening can see if there are any complications in the pregnancy for either the baby, mother, or both. For example, it is possible the fetus might have visible physical abnormalities. It is also possible for an ultrasound to determine miscarriages. And lastly, it can determine if there is an ectopic pregnancy, which is when the fetus is growing outside the uterus. However, in women who are of low socioeconomic status, there are barriers in receiving this treatment. First, there is cost. An ultrasound without insurance can range from $200 to $500 or even more. When a woman is subject to these costs, it can deter them from getting one because they may need their limited income for other things that are also deemed important. Second, there is location. Depending on where the expectant mother lives, it can be difficult to find a center that is number one, cheap, and number two, a short enough distance from their place of stay. Alongside this is the wait time. Even at free clinics, there can be a wait time to be seen by a healthcare professional for these screenings. Low-income women often have long work schedules and they have to find time to fit it in their schedule to go to the clinic and wait for an appointment. Lastly, a lot of fear comes with being an expectant mother and low income. The hope is that these tests lead to positive outcomes for both the baby and expectant mother. However, sometimes the news received on scans can be super overwhelming and can create a lot of fear. The cost of having a child with a disability can be a lot more expensive, money and time-wise, than having an able-bodied child. Therefore, it's super important that expectant mothers do have these screenings so they can prepare or make decisions about continuing their pregnancy. Although these barriers exist, there are also ways to address them and provide care for women regardless of their socioeconomic status. There are three kinds of organizations that do a great job at providing prenatal care at very reduced rates or free, specifically screenings. First, there is Planned Parenthood, which offers lots of services for pregnancy, and at some locations, they do offer ultrasounds. There are also nonprofit organizations, such as Catholic Charities, that do free screenings and provide therapy services to help deal with the fear barrier. Lastly, the United States has a ton of community health centers. These health centers are located in such a way that you can almost always find one within a 10-mile radius of where you are. The United States Department of Health and Human Services has a comprehensive list of all of these locations.
Hi guys, my name is Orlando, and today I'll kind of be talking about the possible prenatal, postnatal, during the pregnancy social programs and services that are offered, when they began to roll out, how they're doing now, and so on and so forth. So social programs and services began to roll out roughly around the 1970s, late 1970s, I would say, especially with the purpose to kind of help the pregnant mothers financially, medically, and nutritionally due to the growing number of malnourished pregnant mothers and youth and young children, as well as an increase in infant mortality rate. Um, to list off a couple of the social programs and services that are offered, Medicare is one of the biggest ones that started off early. Maternal and infant health program, which is pretty state oriented. Michigan's is pretty cool. And then Women's Infants and Child's program, which is known as WIC as well. Medicare in the late 1800s. Wow, not 1800s. In the late 1980s, Congress focused heavily on allowing for a broader population to qualify for Medicare. If you don't know what Medicare is a nationwide quote unquote free healthcare or assisted healthcare program. In 1985, only about 15% of childbirths were covered by Medicare. And we can all kind of assume how expensive childbirth is, especially with hospitals, being allowed to charge us for the air that we breathe in there, which is why itemized bills are a thing. Besides the point, 6 years later, 1991, the percentage of childbirths almost doubled to 32% of childbirths covered by Medicare, which is very good. So moving on, I want to talk about the maternal infant health program. The maternal infant health program is a referral only program. So this means that only physicians are allowed to kind of refer their patients to them, to the local government for the program. And that begins at conception up to 8 weeks postpartum. So 8 weeks after the baby's born and or up to the first birthday of the infant. And this helps with the health of the mother, the health of the child, that they can possibly be in harm of, or for complications, neonatal and postnatal loss. So by that, to kind of simplify it a little bit more, if the baby is at risk for anything because of the age of the mother, or the possibility of child neglect based on how many children the family has, substance abuse, substance misuse, substance use in general, living conditions of the baby and the mother, poor mental health, all these are factors that mothers deal with. Postpartum depression is very much a thing, and it can sometimes go ahead and just in many ways not be beneficial to anybody. So the maternal infant health program kind of helps ease some of those concerns if it gets to the point where one, they can't afford it, two, it gets too much. Which luckily Michigan's is a really, really good one. I believe they also go ahead and offer at-home visits for those who can't make it into an actual clinic, which is a very, very nice thing as well. Moving on to WIC, or otherwise known as Women's Infants and Child's Program. So this was actually the very first program implemented for women themselves, that aim to assist mothers in buying and provide healthy foods for themselves and their families, which my mother was part of. I think that the program is very, 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 very helpful, especially being part of a single parent family. So the first WIC establishment was opened in Kentucky in January 1974, and later began operating in 45 different states. WIC pretty much partners with local grocery stores in allowing government-funded coupons on eligible certain nutrient-dense foods or foods that are considered healthy. So, for example, if you go ahead and have a coupon for cereal, it'll be like Honey Nut Cheerios rather than like Captain Crunch, or 2% milk or 1% milk rather than chocolate milk and stuff like that, which honestly is just such a big help, especially for single mother families.
Another important aspect of prenatal care that may determine the outcome of one's pregnancy that women of low socioeconomic status tend to not have access to is nutrition services. Nutrition services are essential to the health of expecting women as well as their fetus's health, and should be integrated and be a part of the routine care for all women. Some of these nutritional care activities that are vital include adjusting dietary intake, assuring they are receiving the proper vitamins and minerals needed, and even quitting substance use. However, for some, specifically low-income pregnant women, they have limited ability to buy healthier food options or the food they need. Low-income women are already at a higher risk for prenatal complications, and not being able to access the services they need in regard to nutrition or having inadequate dietary quality increases that risk even more. Thankfully, for those women that may have low socioeconomic status, every state health department has a unit called the Maternal and Child Health Unit. This unit helps with assistance in various areas, including specialized consultations, but most importantly, this unit assists with resources for food and nutrition programs. One of the most prevalent programs is the Special Supplemental Food Program for Women, Infant, and Children, also known as the WIC program. This program is vital as it helps to promote proper nutrition intake and helps to gain access to adequate prenatal care for low-income women. In a study conducted comparing the benefits of WIC, it can be seen that recipients of WIC during pregnancy experience a lower risk of premature birth as well as lower rates of infant mortality in comparison to their counterparts who did not receive WIC during their pregnancy. Every pregnant woman should consult a physician, dietitian, nurse, or midwife to assess any other factors that may either enhance or get in the way of healthy eating and proper nutrition during their pregnancy. If one does not have one of the following to consult, there are also ways for the Maternal and Child Health Unit of one state department to help obtain things like Medicaid or overall access to certain providers that can assist in prenatal care.
In conclusion, we can see a lot of overlap in barriers to access of care for women of low socioeconomic status in the United States. Ultimately, it is important to spread awareness to the importance of prenatal care to these women as they are proven less likely to have adequate access to it.